NLN NEX Real Questions. Question 1. Which second quantity matches a 2 to 4 ratio when the first quantity is 10 in this unit conversion item? Option A, 20. Option B, 10. Option C, 25. Option D, 30. The correct answer is option. The first part grew from 2 to 10, so the scale factor is 5. Multiplying the second part, 4 times 5, gives 20. The other values use the total, the first quantity, or an extra scale step instead. Question 2. During a quick NEX review of a percentage item, which word is closest in meaning to obtain in a health article? Option A, deny. Option B, lose. Option C, get. Option D, melt. The correct answer is option. Obtain means get, so that choice matches the meaning in context. Deny means refuse, not get. Lose means no longer have, not get. And melt means turn liquid, not get. Question 3. After checking the choices in a fraction item, which answer identifies the substance dissolved in a solution? Option A, precipitate. Option B, solute. Option C, catalyst. Option D, solvent. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, catalyst speeds a reaction, and solvent does the dissolving. Question 4. If a mean score stem gives one clear clue, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training increased infection rates. Option B, training may have improved compliance with hygiene practices. Option C, the refresher removed all risk permanently. Option D, hand hygiene cannot affect infection. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates, is not supported by the passage. The refresher removed all risk permanently, is not supported by the passage. And hand hygiene cannot affect infection, is not supported by the passage. Question 5. When time is limited on a probability set question, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart? Option A, 10. Option B, 7. Option C, 48. Option D, 29. The correct answer is option. The increase is the final value minus the starting value, 29/19 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a test strategy item, which weight in pounds is closest to 45 kilograms using 1 kilogram equals 2.2 pounds? Option A, 99 pounds. Option B, 20.45 pounds. Option C, 990 pounds. Option D of 47.2 pounds. The correct answer is option. Multiply kilograms by 2.2, so 45 times 2.2 equals 99 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 7. Suppose a similar main idea item appears on test day. Which word is closest in meaning to prior in a health article? Option A, silent. Option B, later. Option C, earlier. Option D, hidden. The correct answer is option. Prior means earlier, so that choice matches the meaning in context. Silent means quiet, not earlier. Later means afterward, not earlier. And hidden means concealed, not earlier. Question 8. While working through a timed inference clue set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, convection. Option C, conduction. Option D, irradiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas. Convection moves heat through fluid circulation. And radiation transfers energy by waves. Question 9. Before choosing an answer in an author purpose item, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, reminders can help patients remember appointments. Option C, appointments no longer need scheduling. Option D, patients cannot benefit from reminders. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders caused more missed visits is not supported by the passage. Appointments no longer need scheduling is not supported by the passage, and patients cannot benefit from reminders is not supported by the passage. Question 10. A student sees this summary task idea on a NEX review. Which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, evaporation. Option C, convection. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 11. One sentence correction practice problem tests this skill. Which number is 40% of 200? Option A, 80. Option B, 240. Option C, 160. Option D, 800. The correct answer is option. 40% means 40/100, so 200 times 40/100 equals 80. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 12. Several choices look tempting in a punctuation review item. Which word is closest in meaning to require in a health article? Option A, borrow. Option B, avoid. Option C, need. Option D, whisper. The correct answer is option. Require means need, so that choice matches the meaning in context. Borrow means take temporarily, not need. Avoid means stay away from, not need. And whisper means speak softly, not need. Question 13. For this pronoun agreement nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, bias. Option B, classification. Option C, replication. Option D, estimation. The correct answer is option. Replication checks whether results are reliable across repeated trials. Bias is a systematic error, classification is grouping items, and estimation is an approximate calculation. Question 14. In a short parallel structure practice STEM, which answer best explains the author's point? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed sets remove all content gaps. Option C, timed practice can build exam familiarity. Option D, the exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Timed sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 15. Among the choices in an active voice item, which critical thinking response best fits this situation? A patient says, "I feel better, so I stopped the medication early," in a health literacy passage. Option A. The statement shows a need for clearer teaching about completing treatment. Option B. Medication should always be stopped early. Option C. The patient fully understood the instructions. Option D. Teaching is unrelated to medication use. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Medication should always be stopped early does not follow from the situation. The patient fully understood the instructions does not follow from the situation, and teaching is unrelated to medication use does not follow from the situation. Question 16. Using the facts in a capitalization check question, which probability describes drawing a red card from a set with 2 red and 5 blue cards? Option A, 7 halves. Option B, 2 fifths. Option C, 2 sevenths. Option D, 5 sevenths. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 2/7, simplified to 2/7. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 17. Based on the clue in a clinical scenario item, which word is closest in meaning to sufficient in a health article? Option A, inadequate. Option B, enough. Option C, recent. Option D, visible. The correct answer is option. Sufficient means enough, so that choice matches the meaning in context. Inadequate means not enough, recent means new, not enough, and visible means seen, not enough. Question 18. Consider this high-yield community clinic concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, vein. Option B, artery. Option C, capillary. Option D, trachea. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Vein returns blood to the heart, artery moves blood away from the heart, and trachea carries air. Question 19. Near the end of a student survey review session, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A. Clear formatting helps readers understand health information. Option B. Long paragraphs are best for patient teaching. Option C. Headings reduce the value of information. Option D. Pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Headings reduce the value of information, is not supported by the passage, and pictures make written instructions unnecessary, is not supported by the passage. Question 20. Across similar wellness app nursing entrance questions, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 5. Option B, 8. Option C, 26. Option D, 44. The correct answer is option. The increase is the final value minus the starting value, 26/18 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the practice timer clue, which milliliter amount equals 0.75 L? Option A, 75 ml. Option B, 750 ml. Option C, 7.5 ml. Option D, 7,500 ml. The correct answer is option. 1 liter equals 1000 ml, so 0.75 times 1000 equals 750 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 22. From the information in an exam readiness item, which word is closest in meaning to abundant in a patient education passage? Option A, plentiful. Option B, scarce. Option C, fragile. Option D, silent. The correct answer is option. Abundant means plentiful, so that choice matches the meaning in context. Scarce means limited, not plentiful. Fragile means easily broken, not plentiful, and silent relates to sound, not amount. Question 23. At a testing desk during a quick review, which answer identifies the organ that produces bile? Option A, liver. Option B, gallbladder. Option C, pancreas. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, pancreas secretes enzymes and hormones, and kidney filters blood. Question 24. Inside a hard question science or skills item, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, former patients stopped the program. Option B, personal stories can motivate people to participate. Option C, orientation should never include stories. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program is not supported by the passage, orientation should never include stories, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 25. Through careful reading of a easy question stem, which answer identifies the group that does not receive the experimental treatment? Option A, experimental group. Option B, control group. Option C, sample. Option D, conclusion. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, sample is the participants or items studied, and conclusion is the final interpretation.